Today we will talk about another medical treatment which is receiving much attention, just like cupping, and it's going through a bit of a revival, and that is leech therapy. As you can see in this jar, there are 3 leeches in this jar. These are medicinal leeches. So this is very similar to cupping hijama in that blood is extracted from the human body to improve health, except with leech therapy this is achieved via the leeches, which are in effect organisms related to the worm family, and so we're just using these worms, if you like, as opposed to the medical equipment that you normally see in our cupping videos for hijama. So here we have Brother Wally, and we're going to be placing the leeches on the hand. Okay, we're just going to puncture the spot with this needle, as you can see here. And this is basically to attract the leech to this exact spot. Otherwise, the leeches of their own accord will find a place to cut the skin with their teeth and draw blood. But we're making it easy for them by using this needle method, so the blood comes out, so the leeches will be drawn to that exact spot. So you may be asking, why are we using leeches as opposed to cupping? The reason for that is because the hand is actually quite a sensitive spot. Scars will remain on the hand for a lot longer. Also, wounds open up on the hands because you're using your hands on a constant basis. So it doesn't get the time to heal. So leech therapy on the hands is a perfect substitute to cupping. Sometimes these leeches have a mind of their own. Things don't always go to plan. So it's avoiding the spot at the moment, but you just have to be a bit persistent. There you go. Bingo. It's on the spot. Oh no, not quite. It's come off again. Right, there we go. Okay, so as I mentioned before, sometimes the leech finds a spot of its own accord, which isn't too far away from the spot that we picked, but that's okay. So we're gonna continue with this spot. So we're gonna put one on the front surface of the hand and one on the opposite side. Okay, brilliant. Ah, no. Is it on? It's on. Brilliant. Oh, no. Yes. Okay, it's on. Brilliant. So you'll notice that within a short period of time, their size increases rapidly. They begin swelling because they're basically extracting the blood from the body. We're going to put the third and final one that we have in the jar. We realise this method isn't for everyone. Some people are a bit squeamish at the sight of leeches, but it's a effective substitute. We can assure you of that, and it's widely used throughout the world. And its roots go back to even as far back as ancient Egypt. Okay, so we're doing the neck here. Actually, with the position, Brother Wally has placed the one on under the chin is I believe under the tonsils, because he has a sore throat. As well as the two on the hand, either side of the finger. So if we take a look at the size of the first one, that's almost like 100% increase in size in perhaps 5 minutes. And here on in, it's just a waiting game, and it can take as long as 45 minutes. So as I mentioned, this method's been around for a very long time. Therapy is used for treating nervous system abnormalities, dental problems, skin diseases, and infections. It's also widely used in plastic surgery and microsurgery as well. They're mainly used in plastic surgery and microsurgery because basically these leeches excrete peptides and proteins that work to prevent blood clots, and these secretions are also known as anticoagulants. This basically keeps blood flowing to help wounds heal. So just like cupping, leech therapy's appeal is partly due to its simple and inexpensive means of preventing complications. In the US alone, there are approved clinics for it, and I believe in 2004 the US FDA approved medical leeches for plastic and reconstructive surgery due to its speed of healing. So the other thing worth mentioning, which I briefly touched on, is the saliva from these leeches. Basically, there are over 100 bioactive substances which range from which have amazing effects from this saliva. They basically act as anticoagulants, blood thinners, vasodilator, anesthetics, antibiotics. It's effective also for diabetics as well, because it suppresses blood clotting, and diabetics have thick blood. So we're basically putting these cotton pads in between the fingers because the size of these leeches swells, and just to give them the appropriate room. So the saliva, again from these leeches, it's also been made into pharmaceutical drugs as well to treat a number of conditions such as hypertension, varicose veins, hemorrhoids, skin problems, and even arthritis. It's also been used for relieving head pains as well, headaches, etc., when they're placed on the head. Muhammad Wali's also had some success placing the leeches around the eyes as well to improve sight. I mean, the conditions where we see leech therapy applied today are mainly in the following. Venous congestion, because it speeds up healing. Cardiovascular effects to help reduce the clotting mechanism in stroke and heart attack patients. Arthritis as well, common joint diseases. This, in fact, the reason Muhammad Wali is applying the leeches on the hand is because he has like a mild form of arthritis, which, as I mentioned earlier, cupping isn't really suitable for the hand because the hand is excessively used constantly, and the cupping wounds open up whenever there's movement in the hand. Also, it leads to scarring of the skin. So the Muhammad Wali had his left hand recently applied for with leech therapy, and he had some degree of pain on his fingers, on his knuckles, I believe, and the leech, as a result of the leech therapy, 80% of the pain, 85% of the pain went in one session. Is that right?
One session.
In one session, 85% of the pain went. And that's extraordinary. Leech therapy is also used today for reducing high blood pressure as well, hemorrhoids, blood clots, skin diseases, varicose veins, and as I mentioned before, cosmetic surgery as well. So if we take a look at the size of the leeches now, the first one is perhaps 300% bigger in size. The first one, I'd say it's probably doubled in size. The one on the neck, also perhaps a 100% increase in size. And this process, it's not really painful. I mean, Brother Wali is very relaxed and calm. He's not under no physical discomfort or pain. But unlike cupping, this process does take a lot longer. With cupping, you basically place the cups and apply the pressure, the suction, the vacuum, and within 5 minutes, you're done with one spot. But this can take like 45 minutes per leech on each spot. So it's been about 20 minutes now, and we see the one in the neck has a 3 or 4-fold increase in size. And the ones on the fingers, they too are swelling. So these are termed medicinal leeches, and they have 3 jaws with tiny rows of teeth. That's how they're able to attach onto the body. They basically pierce the person's skins with their teeth and insert anticoagulants through their saliva. We can actually see their saliva if we look on this side here. You can see a bit of the saliva dripping.
You see?
Yeah, I'll just do a close up on that. So as I mentioned, many medicinal benefits from this saliva alone. One thing to also point out is that you must never reuse these leeches. So, for example, if after applying these leeches to Mr. Wali, we then put it back in the jar, you must never take them out of the jar and apply the same leeches on someone else. And I mean, these leeches will basically remain alive and feed off of the blood for about 6 months, I've been told.
They said.
So they're quite amazing and unique creatures. So this is a entirely regulated environment. Mr. Wali's been applying these leeches on certain specific spots, but we have actually seen videos of unregulated environments, like for example in lakes, where people, for example, put their feet in their legs, in fact their entire legs, in a lake which is which has many leeches living within that lake, and they basically attach themselves to whoever comes by and submerges their legs, etc. So there is some risk of like bacterial infection, because basically the leeches are going from one leg to another with that. So one should be a bit cautious of that. So it can also be quite itchy as well, having these leeches applied to the skin. I guess one must resist the urge to scratch.
Look.
Yeah, that's amazing. Yeah, the first one's maybe 4 or 5 times the size.
Maybe that will be.
So after they reach a certain size, they detach themselves of their own accord. Sometimes we have to force them off as well, and if you're trying this therapy, we would recommend to try it with one leech to begin with, because there could be some allergy. So try it with one, see how it goes, and you can always try with 2 or 3 the second time.
Mention this one.
So we just missed the first leech. It just detached itself. Initially it was attached to 2 spots on the finger, then 1, and then it literally just broke off, detached, and we've just placed it in a cup. And the spot that it was attached to is still bleeding. This bleeding will actually persist for as long as 6 hours. We would recommend that you basically use some cotton pad and with some antiseptic, just to prevent the bleeding, just to dry it up a bit. So we see the one on the chin. It's also perhaps going to detach itself at any point. It's probably imminent. The second one on the finger, similarly. I think they probably they swell to maybe 4, 5 times their size, and then that's enough blood extracted for them, and then they detach themselves. It's bleeding. So this, the one on the neck, is about to detach any minute now. We can, of course, force it off. Antiseptic spray is something they really dislike, and they'll detach themselves voluntarily if you apply the spray in that area. And from our first leech, the blood is still trickling out. This is blood with some inflammation. So we actually want the blood to continue to come out. We don't want to place a plaster over it and seal it. But as I mentioned, the blood can persist for as long as 6 hours. So when the leeches detach themselves, we put them back into these jars with water. So just one point is that this is not normal water. This is actually bottled water. That's because tap water, of course, contains chlorine and fluoride as well, which is not good for the leeches.
Look at dripping the blood. It will be like that few hours.
Yeah, right. So just that one spot, we can see quite a lot of blood which is dripping out. And when the second one comes off, that will be a second spot of blood coming out, and then the one position on the neck as well.
Dripping.
Second one has come off the hand. That's two well-fed leeches. So we now have two spots on the hand where
Bleed like that.
the leech bit into the skin, and they're both dripping with blood. So just remember to have all the cleaning equipment nearby, plenty of tissues and cotton pads. So with this third and final leech, we're going to use antiseptic spray to detach it. So the leech hates this spray.
That's it.
There we go. Yeah, it detached itself. Now we have 3 leeches swimming around in this plastic cup. So if you're wondering what happens to these leeches, these leeches are released back into nature. You can go to a park, a nearby park, under a tree, for example, release them there. And that's it.